Senate Bill 14 is a dangerous and discriminatory piece of legislation that would deny transgender youth in Texas the right to health care. The bill would ban trans people younger than 18 from getting certain transition-related care, such as puberty blockers and hormone therapy, which are vital for their mental health. Puberty blockers are medications that temporarily pause the physical changes of puberty, such as voice deepening, breast growth, or facial hair. They are reversible and safe, and they give trans youth time to explore their gender identity and make informed decisions about their future. Hormone therapy is the use of hormones that match the person's gender identity, such as estrogen or testosterone. It can help trans youth feel more comfortable in their bodies and reduce their distress. These treatments are recommended by major medical groups, such as the American Academy of Pediatrics, the American Medical Association, and the Endocrine Society. They are based on scientific evidence and best practices, and they have been shown to improve the mental health and well-being of trans youth. Studies have found that trans youth who receive puberty blockers and hormone therapy have lower rates of depression, anxiety, suicide attempts, and self-harm than those who do not. But SB 14 would criminalize these treatments and punish the doctors who provide them. It would force trans youth to go through puberty that does not match their gender identity, causing them immense physical and emotional pain. It would also cut off their access to affirming and supportive health care providers, leaving them isolated and vulnerable. SB 14 is not only harmful to trans youth, but also unnecessary and unconstitutional. There is no evidence that these treatments are harmful or abusive, as some supporters of the bill claim. In fact, denying trans youth access to health care is a form of abuse that violates their human rights and dignity. SB 14 also infringes on the privacy and autonomy of trans youth and their families, who should be able to make medical decisions without government interference. SB 14 is part of a larger wave of anti-trans bills that have been introduced in Texas and across the country this year. These bills are fueled by fear, ignorance, and bigotry, and they aim to erase and exclude trans people from public life. They have no place in a free and fair society that values diversity and equality. We urge you to stand with trans youth in Texas and oppose SB 14. Trans youth deserve respect, compassion, and access to health care. They deserve to live authentically and happily as who they are. One of the most controversial aspects of the Texas bill that would deny transgender youth the right to health care is that it would also ban transition-related surgeries. These are procedures that alter the physical appearance or function of a person's genitals, breasts, or other sex characteristics to align with their gender identity. The bill's supporters claim that these surgeries are harmful and irreversible, and that children are too young to make such decisions. However, these claims are not supported by medical evidence or the lived experiences of transgender people. According to the American Academy of Pediatrics, the American Medical Association, and other major medical groups, transition-related surgeries are safe and effective treatments for gender dysphoria, the distress that some transgender people feel when their body does not match their gender identity. These surgeries can improve the mental health and well-being of transgender people and reduce the risk of depression, anxiety, and suicide. Moreover, these surgeries are rarely performed on minors, and only after a thorough evaluation by a multidisciplinary team of experts who ensure that the patient is fully informed and capable of consenting to the procedure. The Texas bill would ignore the best practices and standards of care established by the medical community and instead impose a blanket ban on transition-related surgeries for anyone under 18 years old. This would violate the autonomy and dignity of transgender youth, who have the right to access health care that affirms their identity and supports their development. It would also deprive them of the opportunity to make decisions about their own bodies in consultation with their parents and doctors, who know them best. Furthermore, it would create legal and ethical dilemmas for health care providers, who could face criminal charges or lose their licenses for providing medically necessary care to their patients. The Texas bill is not based on science or compassion, but on fear and prejudice. It is part of a nationwide wave of anti-transgender legislation that seeks to erase and exclude transgender people from public life. By banning transition-related surgeries, the bill would deny transgender youth the right to health care that they need and deserve. It would also send a harmful message that they are not accepted or valued for who they are. The bill has faced strong opposition from trans Texans, their families, medical groups, and LGBTQ advocates who say that the bill is harmful, discriminatory, and unconstitutional. They argue that the bill would deny transgender youth the right to health care that is vital for their mental and physical well-being, and that it would interfere with the professional judgment of doctors and the autonomy of parents. They also warn that the bill would increase the risk of depression, suicide, and self-harm among trans youth, who already face high rates of stigma and violence. Some of the opponents of the bill have testified in emotional hearings at the Capitol, sharing their personal stories and pleading with lawmakers to reject the legislation. They have also organized rallies, petitions, and phone campaigns to voice their concerns. They have been joined by several medical associations, such as the American Academy of Pediatrics, the American Medical Association, and the Endocrine Society, which have issued statements opposing the bill and affirming the safety and efficacy of gender-affirming care for trans youth. The opponents of the bill have also challenged its legality, claiming that it violates the constitutional rights of trans youth and their families to privacy, equal protection, and due process. They have cited recent court rulings that have struck down similar bans in other states, such as Arkansas and Tennessee, on the grounds that they are unconstitutional. They have vowed to sue Texas if the bill becomes law, setting up a potential legal battle that could reach the Supreme Court.